that I mentioned. If you saw the topic we'd be covering today, then I'll leave that open to questions and follow-up video later. But I wanted to talk about estrogen, the good, the bad, the ugly, etc. So, and then bear in mind, if you are watching this live, you can ask questions as we go. So I'm going to online here just to confirm that we are streaming and that it is not jumpy and flaky like it was last week. There it is. So there's a delay on it, so I need to mute that because that will be very distracting, especially if you can hear it in the background. So I had a whole 15-minute discussion about the importance of hormones and some important ways to get them tested. I think it's one of the most foundational tests that adults can do. A lot of health problems could be averted and treated simply by starting there. It's not an end-all, but it certainly is a good starting point. And so estrogen specifically, when we talk about that, it's important to make a couple of points. One is that estrogen is not just a woman issue. Men have estrogen and related metabolites in their bodies as well, and they're important in correlating with certain health problems and conditions. So the whole question of is estrogen good or bad is really dependent on what forms of estrogen do you have. And that's the advantage of doing urine hormone testing, is that we can tell, do you have excess of the bad estrogen? Do you have sufficient levels of the good estrogens? And of course, there's related hormones, including adrenal hormones, and for men, the sex steroid hormones, testosterone. And a lot of those will be affected by the estrogen balance as well. And so I think the gold standard is to get urinary hormones checked so we can look at those levels and move accordingly. So, things like breast cancer, uterine cancers, prostate cancer, those are very correlated with excessive levels of estrogen metabolites that we can now detect on a lab test. And so we want to know, if you're too low in estrogen, but also what kind of metabolites you have. And then, of course, we can very directly and simply treat that and correct those imbalances with some natural medicine, sometimes with hormone replacement. So anyway, so again, common symptoms with estrogen problems, they might include osteoporosis. You might have early degenerative joint problems, so osteoarthritis, fatigue, low libido, and weight gain that's not improving over time. We know that also estrogen affects the brain quite a bit. So early cognitive decline and problems with memory, and ultimately even dementia and Alzheimer's, is associated with a decrease in estrogen levels. And those, including in men, also though with men it's important that the testosterone levels are maintained as well for that brain health. So I can't say enough about that. So simple urine test. I'd love to talk more about that. As questions come in, I'll go over that as well as we see fit. I guess I'll wrap up just mentioning a couple of key nutrients that we know help estrogen that I often recommend. One would be iodine. So it's good to check and know what imbalances exist, but iodine is often very deficient in our diets. And we're looking at optimum iodine intake versus just maintaining the basic low levels that are typically in supplements. And so typically we need to take in milligram levels of iodine to restore levels. And it will improve and reduce cancer risk in women. It reduces the risk of breast cancer. It reduces infection rates. It helps reduce fibrocystic breast problems. So just to name a few. The second nutrient that I'll mention is vitamin A. So retinol or retinoic acid, the active or the sort of the mammalian or human form of vitamin A. I'm not talking about beta carotene that comes from plants, but the active form of vitamin A has been shown to help with estrogen levels, especially estradiol levels. And the benefit also of vitamin A is it helps the immune system in the barriers of skin, improves skin and digestive stomach and digestive tract. Your skin cells and digestive tract cells need a lot of vitamin A, and they help. It also, like I said, helps your immune system, along with your sex hormones. So, typical doses for women who aren't possibly going to get pregnant or who are pregnant, I recommend levels at about 25,000 IUs per day. Men, that about the same. Sometimes men and women, again, could be up to 50,000, but do consult with your physician and probably have some testing to assess what level is appropriate. For women that are younger or potentially could be pregnant, there are some mixed studies about that. As soon as one knows they're pregnant, we recommend that you don't take over 10,000 IUs of vitamin A. So just note that, but you could certainly take some vitamin A and make sure you're at least getting 5 to 10,000 IUs per day and get yourself taken care of. So that's it for now. We'll pick this up again next week. Hopefully 12:15 Tuesdays will be fairly consistent, and maybe someday we'll have some people on live and get some questions going. So talk to you soon.